actually know about inflammatory bowel disease? Come, let me explain. So inflammatory bowel disease is a condition where there is an immune mediated intestinal inflammation. So the keyword over here is inflammation. One of the type of your IBD is the Crohn's disease. What causes this Crohn's disease is basically autoimmunity. Autoimmunity means the family history of the Crohn's disease or a genetic mutation basically leads to the hyperactivated state of this Th1 helper cells. As these Th1 helper cells are hyperactivated, the stimulants such as Western diet or if an individual is a chronic smoker basically stimulates these hyperactivated cells, and that leads to the release of a cytokine such as tumor necrosis factor and interferon. As the cytokines are an inflammatory mediator, they basically start the process of the inflammation, which ultimately results in a transmural ulceration. Transmural ulceration means there will be an involvement of epithelial layer, lamina propria, muscularis mucosa, submucosal layer, as well as your muscularis externa. One more characteristics over here is granuloma formation. Granuloma is nothing but a clumped area of neutrophils, macrophages present in the inflamed tissue. Important characteristics of the Crohn's disease is that it basically occurs anywhere from mouth to anus in your gastrointestinal tract. The most common site of the Crohn's disease is basically your ileum, and that is what results in right lower quadrant pain. Major function of your intestine is absorption. The damage to the ileum basically leads in a malabsorption, and this malabsorption solutes basically causes the osmotic pull of the water and basically results in osmotic diarrhea, which is non-bloody in the nature. There is a characteristic finding of skip lesion. Skip lesion is basically a separated inflamed area from the healthy tissue. It means there will be a part of the intestine which will be inflamed. Again, there will be an healthy tissue. Again, there will be an inflamed region. Again, there will be an healthy tissue. So this basically pattern follows up, which basically gives the characteristic finding of skip lesions. Thank you. Follow for more.